This is Dr. Theal. In this session, I'm going to demonstrate completing a upper endoscopy or esophagogastroduodenoscopy note on a patient. In this session, I'm not going to narrate the various sections of the note because that was done previously. Instead, I'm going to document the same information that was outlined previously in this demonstration, but do it only by completing the sections in the way that a physician would if they weren't trying to demonstrate to anyone. And the purpose of this is just to show you how quick and easy it can be to complete the note once you're used to the system. So I'll begin. This 54-year-old gentleman who has a history of hypertension as well as cirrhosis presented to the emergency department with a one-day history of melena, as well as pre-syncope, and shortness of breath, period. There was some nausea but no vomiting, period. There was no syncope, period. In the emergency department, he was transiently hypotensive and required intravenous fluids, period. An emergency gastroscopy was required to determine the source and treat upper GI bleeding, period. Distended abdomen, with shifting dullness, suggestive of ascites, period. This 54-year-old gentleman who presented to the emergency department with melena in the context of cirrhosis and hypertension was found on gastroscopy to have a clean-based antral ulcer, period. He also had small esophageal varices which had no stigmata of recent bleeding and did not require banding, period. The ulcer itself was not actively bleeding and did not require any endoscopic treatment at this time, period. I would recommend proton pump inhibitor therapy for this patient, period. Okay, and the note is complete. And here's how it looks once it is rendered, and this is how it will be sent to the on-call physicians as well as to the family physician and any other consulting physicians, including the pre-procedure information the narrative text about why the procedure is being done, the procedural findings, the images, diagram, and finally the impression and plan. I'm going to sign that note, and you will see that I've actually also added 2 diagnoses to the chart automatically by completing the note, so that in future, if anyone goes back to see this patient, in the diagnosis section, they will see that the patient had an ulcer and esophageal varices on today's date.